Dear colleagues, welcome to the course IT Technologies and eHealth. This course is being provided by Sechenov University and Digital Health Institute specifically. My name is Konstantin Koshichkin. I am associate professor of the institute, and my previous experience was in area of digital support for healthcare organization providing expertise for medical products in Russian Federation. My current areas of study are related to development of blockchain technology implementations in healthcare, telemedicine, identification of medical product standards implementation, and other technologies related to neural networks, artificial intelligence, providing better pharmaceutical studies with contemporary technologies and all related issues. And today we'll talk about e-health in general, and this is introductionary part of our course, and I will talk about general subjects in this area. There's something to start with. Let's talk about why you need to study IT technologies and e-health. It's totally understandable that in current situation, medical professionals need additional experience in IT technologies and in general regarding internet technologies implementation in healthcare, and our course covering medical information systems or so-called hospital systems, telemedicine services, virtual and augmented reality, artificial intelligence, big data, and other such hot topics. And we will try to teach you the basics of this area of science and of technology. Our aim is to develop basic skills regarding implementation of internet and information technologies, application of informational systems. We'll study different ways to navigate in the area of data gathering from different kind of databases, data processing with mathematical models, and questions of development of software solutions which could be implemented in hospitals or on a higher level, on the state level, for example. Of course, we will cover some issues regarding protection of personal data and related issues and other questions. To start with, let's talk about our course and how it's structured. Today it's lecture number 1, it's introduction. We will cover as an overview of this area, and right now we are looking at our study plan, and later I will provide you an overview of digital health institute activities and the whole area of digital health in general. The second lecture will be about digital transformation of healthcare, and I guess digital transformation is another hot topic, and it could be applied to all kind of areas, but we'll talk exactly about how we can change healthcare with implementation of digital technologies. So we'll cover the concept of digital healthcare, unified information systems in this area with some examples, components of digital transformation in Russia and worldwide. Regarding medical information systems, we will study why they're being implemented, which tasks are they solving, their structure, exploitation, which processes could be organized in them, for example, pharmacy automation, medical equipment, accounting, calculations regarding medical services, scheduling, and others. Of course, we'll cover some questions regarding electronic medical records also. On our fourth lecture, we will cover provision of medical care using telemedicine technologies. The general concept of telemedicine, legal issues, ways how it is being developed, organization of the telemedicine offices, and how it could be organized on a higher level. For example, on the example of Russian Federation, we will look at state level of organization. And later we'll cover more complicated issues, for example, regarding application of internet in healthcare, which databases we have available online, which of them could be used and for what issues. For example, it will be databases of WHO, global burden of diseases, some catalogs of publications, PubMed, Cochrane libraries, and we'll cover some methods how we can automate our access to the databases using, for example, programming language, and which tasks we can solve using these databases and why we need to access them. And later we will cover questions regarding interactual systems, and it's quite important right now when we can use artificial intelligence as a extension of human intelligence, providing additional insights and second and third opinions to doctors, and it's being possible only with implementation of big data gathered from patients treated by real doctors and on their information. So we will have overview how these technologies could be implemented in healthcare. And also we'll cover mathematical methods in general, how they could be used to analyze this data, how they could be used for processing information, gathering, clearing, and other related issues. I believe that it's important for us to cover some basics right now, and I need to tell you definitions of the terms which I will be using later. For example, e-health could be assigned to digital health. Right now it's quite similar terms. And digital health is a discipline that includes digital care programs, technologies, healthcare, society, improving efficiency of healthcare delivery to make medicine more personalized and precise. So we are using different types of digital technologies to improve our healthcare, and we call it shortly digital health or digital healthcare. And mostly we are talking about different software solutions implementations, about digital services provided to patients, telemedicine, applying wearable devices, gathering data in digital form. Of course, it will be about augmented reality or virtual reality and related questions. It's a hard question what we call big data. I guess this term generally is being described as excessive amounts of information being used for purpose of data analysis and processing, and when it's impossible to keep all the data on one storage in one database, or it's not structured, and also it is being held in excessive amounts, so we can use the term big data. And we have specialized technologies to process these amounts of data to provide analytical results from its aggregation and processing. And of course, I guess most important right now term is artificial intelligence. And in medicine, it is use of machine learning models to search for medical data and uncover insights and improve health outcomes for patients. So it's not a strict technology or strict methodology. It's an umbrella term to cover all the substitutes for human intelligence. So each time we're using some algorithm or software product replacing humans in making some decisions, we can talk about artificial intelligence. And there are a lot of possibilities how AI could help medical professionals to provide their services. And of course, it's quite impossible for each doctor to analyze all the publications, for example, and to have the most recent data regarding healthcare in general and treatment of different diseases specifically. So AI system could analyze big data and provide these insights for the doctor. So he will be basing his decisions on the all available data currently. Of course, virtual reality and augmented reality, I believe it was a long time since we saw these technologies in TV, movies, or something like that. And right now, they are being implemented in real life, and I guess these implementations are very practical. Virtual reality will provide some kind of eyeglasses, completely removing person from real world and providing substitute for the all information being received. So it's some kind of immersive experience, and it could be used for doctors to operate, for example, using robotic manipulators or something like that. And augmented and mixed realities are technology when we provide additional data, combining it with the real world information. So you actually can see the real world through the augmented reality glasses, and there will be just an additional information in the area of view, providing you help and insights. Telemedicine technologies are distribution of health-related services and information via electronic communication technologies. So each time you're talking with a doctor or providing or receiving help, you are using telemedicine. And in general, the problem is that these consulting services are not being regulated currently, and we will talk about how these technologies could be legally a substitute for a visit to the doctor, for example, to open a sick leave or maybe to receive a prescription for medical product when it's impossible for you to visit the doctor in person. Medical information systems are a vast area of software solutions which cover automation in hospitals, and they cover in general administrative questions, but also could implement data storage regarding patient electronic health records and scheduling for patients and all the related activities. So we can totally automate all the activities in hospital using hospital information system. Talking about digital health and its current status, we should name that in most of the developed countries, these technologies are relatively on the same level, and all over the world we are talking about legislation to make these technologies more legally acceptable from the side of patients, doctors, insurance companies. And for example, if we will address a Digital Health Innovation Action Plan from FDA, it's United States Medical Products Regulation Agency, there will be questions related to guides how these technologies and software products should be regulated, which could be used for clinical decision support, which functions is possible to automate in it, and so on. There are also a lot of related questions raised in Europe, and of course they are very important because they need to organize healthcare system of several countries which are in the European Union, and it's very important to have common services to provide medical data to patients in different countries. For example, if one person traveling from his home in one country to his job in another country, he should be able to receive all his information transferring from one medical organization to another. So sharing of health data for healthcare system is a quite important issue, and the main problem is who should control this data exchange. And of course, the main idea for now is that patients should own their medical data and should decide which medical organization could have access to this data and who could not have this access. And it could be done with relative regulations, and to make these regulations in place, there are a structure called eHealth Network, and in this organization is being decided which standards for data exchange are being in place and are being used. And of course, a lot of these questions are related to medical services market, and in Europe it's a global market divided into several countries, and problems regarding legislation should be harmonized because it's impossible to treat patients on different standards if it's one legal entity, this union of countries. Also, it's important to say that there are it's common to name data related to medical information into two parts: primary data gathered from patients and used in medical organizations to organize treatment of these patients, and secondary data. Under secondary data, we commonly found information without personal data, which will be used for training of artificial intelligence system and for other means, for example, for clinical studies and some epidemiological studies and other scientific means. So it's also important to agree which actions should be done with personal data to be available for secondary use of this information, because this use is also very important for development of healthcare systems in general, and to make availability of to use new technologies to help patients. So, in general, aim of implementation of these technologies are better healthcare, better policy making, better research and innovation, and to make it possible, there should be legal structures in place. So there should be requested quality of data provided, and of course there should be infrastructure if we are talking about data gathering, because it's quite common even now when doctors have only paper-based materials regarding their patients, and of course it's impossible to use this data anyhow later, and we need them in digital form. Also, it's quite important to build capacities, and first of all, it's a question of personal training, and I guess it's a major pinpoint when our medical professionals will be supporting implementation of digital technologies, and it's a major problem right now that doctors do not want to use digital systems to automate their everyday work, and they're quite good with their paper-based documents, and there should be additional trainings in place and explanations so why we need to organize everything in digital form. To provide this capacity for automation, there are several projects running right now. Patient information gathering, electronic prescriptions, laboratory reports, image gathering, medical images, scans, or something like that. Hospital decisions, discharge reports, for example, and other all these data sources will be impossible to operate without them, and we need these capacities in place to create a digital healthcare. So for Europe, the target is 2025 to provide all required infrastructure, to prepare all the legislations, and prepare personnel to operate in these conditions. It will cover several needs, for example, the need for health data for healthcare provision. It will strengthen rights of citizens on their health data. It will solve technical means to support access to and control by citizens over the data. There will be common standards and technical requirements for data exchange in healthcare implemented, and of course, at the end, we will have positive impact on the healthcare in general. Talking about standardization of data exchange, we should name that there are several classifiers, for example, SNOMED and MEDRA and LIONC. These classifiers are being used in clinical practice to identify different terms, and only using such vocabularies we can make this data interoperable. So in one medical organization, it will be the same terms as being used in other organization, and of course if we are talking on a global level, these ways to describe medical information should be used even in different countries in the same way, so this data will be exchangeable between countries if patients will decide to provide this information for some legal entities in another country. Second need is provision of telemedicine and mobile medicine, and Talking about these two types of technologies, we should name that telemedicine right now is being applied generally when we have some kind of cabinet with uh, telecommunication equipment, for example, some kind of display with connection to the internet to another hospital, and doctors could gather to decide how the treatment is going, what are the results, and provide consulting. And when a patient is at home, it's quite easily for him to communicate from his mobile phone using some communication applications, specialized or in common use, to get access to his doctor and to communicate with him. And in this area, we're talking what regulations should be in place, how medical professionals should use these technologies to communicate with the patients. Of course, there are always issues, how these services should be paid for example, and authentication for doctors, for patients, for information, sensitive data provision. So there's a lot of open questions in this area. The third need will be access to the personal data and make it available for research, policy making, regulations, and other. Of course, it's a very vast question, and I will not cover it in our introduction section. I will just say that these regulations are being partly in place with GDPR in Europe regulating private data management, and this not always is helping to provide mm, distant medical services, and of course it should be regulated, so everybody on this market will benefit from using these solutions and technology. Talking about artificial intelligence, we should name that there is a question about liability. Can we trust decisions made by artificial intelligence, even if they're not the last decision, but as advice for the doctor? Should we trust these advices? Should doctors trust these advices, first of all? And who will take responsibility for these advices? Is it developer of software solutions with artificial intelligence, or it will be doctor who is using this solution, or maybe artificial intelligence itself should be responsible for them? And there should be different ways to measure effectiveness of these solutions, and it's quite important because as always, new technologies at first are looking very fruitful, but in some time everybody will think that there are a lot of problems with them, and maybe we should find the correct way in which level we should trust them. So to organize this data processing in Europe, there are several sections. For example, cloud computing used for artificial intelligence, data processing for cancer images, genomics, testing, cybersecurity, accelerating of technology use, and I guess it's a most related area of interest right now. And of course, all these interests are being increased by coronavirus, and there are a lot of resources regarding the data from this infection, and they are being analyzed in different systems, and all this data is being processed on a specific portals in European Union. Also, we're talking about large amounts of data, which is quite impossible to store in some resource of the patient, for example, on his mobile phone or some flash drive. This data should be stored in more sophisticated storage, and for example, there is being developed a cloud solution to store health data and provide a link to this data for patients. Another example of implementation of digital technologies right now in European Union is coronavirus digital certificates, and they are covering almost all countries and are very helpful to receive information that patient has been vaccinated or not, and in several countries, these certificates are required to make it possible to enter the country, and this technology became quite important right now. And this certification is based on public and private key architecture, and there are always country of issue and country of verification for these certificates. So this data exchange is already in place, and I believe that these certificates will be a pilot for general technology for medical data exchange between different issues, because with this QR code we can code a link for any amount of medical data that's being stored in the cloud, and it's quite easy to copy this data from this database to the sources of medical organization where you apply for medical services. Let's get to Russia Federation, and I will name some related topics in this country. Of course, first of all, we should say that there is a federal state information system in the field of healthcare, which is a central component of information in healthcare, gathering all the data from different sources, different providers, and this system is managing access to the data and provide it in electronic form. This is being done under the national project called Health, and this is quite useful solution, because it helped to communicate different regions of the country on the level of medical information, because the development of the digital healthcare system in Russia was going from bottom to top, and at first there were medical information systems in some medical organizations. Next we had regional medical information systems in some regions, and right now we are talking about gathering all the regions together in one system, and we can see that number of users for this data being raised from year to year. In this system we have different types of account. It's simplified and verified accounts. They have different rights for data access. For example, with on the portal of My Health, with a simple account you can only make an appointment for the doctor, and you will need certified account to receive medical information, because it's being viewed as confidential. In the system we can find information about attachment to the medical organization, cost of the services provided, and all the questions related to the health insurance. when we make an appointment to the doctor, it's became quite easy. We just need to apply to this website or portal for this system and or use mobile application and just choose required specialist in your medical organization. Of course, you should be attached to this organization beforehand, and when you will come to the doctor, there will be already a time slot made for you, and your information will be accessed by the doctor at any moment. So you don't need to make a long queries at registration desk, long queue at registration desks possible. And of course, there are information about medical organizations, about services provided. It could be found on the portal also. And you can apply to the medical organization also to be attached to it also online with this application. And all this is possible as a part of a general project. And this project is being aimed at digital technologies implementation to reach goals of citizens development, and main goals are to provide medical help on the everyday basis, to create required infrastructure, and after that we'll have electronic medical records, regional medical information systems, registries of the patients. We'll have all the information about services that are being provided. Also, this infrastructure will capacitate implementation of telemedicine, because it will be easy for a doctor to have access to the patient's information if he will reach him by some mobile application or something like that. And of course, it's a very important question about education of medical professionals, so they will be able to use all these digital technologies. And also this project aims to fight specific diseases, and they two of them were chosen, for example, cardiovascular diseases and oncological diseases, because the main possibility to reduce number of deaths related to these diseases in early diagnostics. And if you have digital technologies in place, it will be much easier to provide this diagnostics by gathering additional data from the patients, by providing consultations distantly, because it's not always possible for patient to visit doctor when he have some symptoms, but he can just send him a photo. For example, in skin cancer, we can use mobile application to scan all the skin abnormalities, and the software will provide insights should you address your doctor or not. And if you will go to the doctor in time, the results will be much different in treatment, I mean. Talking about level of development, we should say that current data exchange system provides information exchange for medical health records, and telemedical technologies are also being implemented, but we can say that level of this implementation is very high, and this is because It's not quite understandable for now for doctors who's responsible for the service, how this it's being paid for, and all the related organizational issues. So I guess in this area we went from technological issues to organizational issues. And regarding artificial intelligence to process data gathered, we're on the initial stage because right now amounts of data to analyze are too small to make it possible to train such a technological services to be liable, and it will take some time to gather marked up data on big numbers of patients, so we'll train our systems to operate. Talking about challenges, I should name its competence and knowledge of personnel, involvement and readiness of patients, and of course there are questions of efficiency and safety for use of these systems. And of course there is a strategy should be in place for implementation and validation of such resources. And of course, there are legal questions, as I told before. Now let's switch to our institute, Digital Health Institute of Sechenov University, and I will tell you about major projects in which are we being involved right now. The purpose of the Digital Health Institute is to develop, implement, and maintain digital medical technologies in Sechenov University and participate in such technologies being implemented on the state level. So it's important to talk about our activities because it's a good overview what could be done in your countries and what are the emerging areas of digital healthcare. Talking about basic features, our institute aimed for scientific research. It's studies, development of different technologies, and their implementation. Of course, there are educational part of activity, theoretical studies, practical, and other, and implementation of innovations in operation. We are working with medical workers, health organizations, individual learners, and patients, providing different types of activities for each of them. Talking about education, we are working with different groups of students. In general, there are medical students on studying pharmacy, bioengineering, medicine, pediatrics, biochemistry, and other areas. And in our institute, we provide data about digital healthcare for them. Of course, I should name master's degree, and it's also very important to provide our knowledge in healthcare digitalization for graduated medical professionals, so they will be improving their skills in this area. Also, I should name that we have a bachelor degree in engineering, and we have students being learning disciplines of information technologies in general, computer science, software development, and related issues. Going to our projects, of course, I should name that we're actively working in the framework of institutions dealing with novel coronavirus infection, and in this area we are working with data, providing calculations for dynamics of morbidity and anti-epidemic work, and analyzing trends in population, and on the high level, analyzing all the data gathered in the country. Talking about knowledge management, we have our own knowledge management system based on artificial intelligence under the hood, and this system gathers data from open databases, and for example providing insights for drug-to-drug interactions, and these interactions are being gathered from contemporary publications in reviewed magazines, and it's quite useful as for medical professionals, and also this data could be used for patients, for example. Talking about technology, how it being done, we can say that it's the most cutting edge technologies of natural language processing. It's BERT algorithms of neural networks, and we're extracting data from texts of these articles, and arranging them into structured insights related to the medical products or diseases, providing treatment standards and documents used for knowledge management. Also, there is projects which are being done with clinical departments of our university, and for example, it's study how mobile measuring tools could be used for patients with neurological diseases, and using this technology make it possible to make some tests for patients by themselves without visiting doctors, and for example, it will reduce exposure to other patients, and will reduce coronavirus spread rates in the country. Another area of activity is development of a tool to create digital pictures of microscopic preparations, and to process them in digital format required in healthcare system, and this tool is much cheaper than its competitors. Another interesting implementation of digital technologies are ultrasound robotic hand, which could be operated distantly. For example, this tool could be used in some distant locations where it's impossible to keep doctors on board, and they can connect via satellite connection to this diagnostics workplace, and work with their patient using this robotic arm to manipulate ultrasound to make a diagnosis. Our institute also work in the area of standardization, and for example, we're part of work group in Washington, United States, and we're right now developing standards for application of AI, artificial intelligence technologies in healthcare informatics. And it's a very important activity because the main problem in artificial intelligence implementation right now is a question about standardization actually, and how we should treat this technology. And when we will agree on the same terms in using these solutions, so it will be much easier to implement it in practice. Also, I need to say that there is an initiative to create a common body of healthcare legislation in post USSR space called right now Commonwealth of Independent Countries or States, and it's quite important to have the same legal basis in this area, because level of exchange of people from one country to another is in this area is very high, and it will be much easier for medical professionals to operate if they will be able to trust results from their colleagues in other countries. It could be made if we will use the same legislation and standards. Also, we participate in Global Burden of Disease initiative. This is a global project to gather information about structure of diseases and which problems are related to them, and in this system we provide information regarding situation in Russia. Also, we are working with different institutes, for example, Institute of Cluster Oncology, and it's a clinical study to assess possibility for remote monitoring of patients during the period of chemotherapy for oncological diseases. And it's quite useful that it's not strictly required for patients to stay at hospital during this period, and it will be much easier for them to receive this treatment at home. And in many cases, it's very important to control state of health of these patients, and mobile technologies could help us here for monitoring of vital data from these patients, and doctors will receive it directly via the information systems. Another interesting area is application of digital technologies in psychiatrics. For example, it's being used for autism treatment, and insights from these studies will help us to develop more knowledge about these patients in future, and it will be easier for us to find the best way to treat them. Together with our clinical practitioners, we are working under integration of medical information in oncological registries, introducing machine learning in computer tomography and MRI scans to provide insights on and additional opinion for doctors. And another activity is related to creation of digital pathomorphological banks integrated with pathomorphological studies, and this is being integrated with information gathered from mobile application and remote monitoring devices. Also, it being used in creation of intelligence services and personalized services for patients. It helps to plan individual treatment strategies for them. Also, we can share information about our solutions that are used in pregnancy monitoring and control, and it's also quite important area of activities. As example of digital technologies working with video stream capture, we can name this system of operating table control turnover, and using this system we became able to increase number of patients being treated more than 20% by knowing exactly which operation tables are ready for being used and which are currently occupied. Talking about the future, main directions of development lie in scientific and methodological substantiation and support of epidemiological monitoring and mathematical modeling systems. For example, it will be remote monitoring of health and implementation of AI systems based on this data. Of course, we will develop additional regulatory documents, modernize our infrastructure, and of course provide education for IT specialists, and not only IT but also for healthcare professionals. I guess it's all for introduction. Thank you very much, and I'll be waiting for you on our next lectures. Thank you very much.